And what were you doing before CareLineLive?
Before CareLineLive, we were completely on paper. So the the rostering system we did use another company for, but care plans, all the care notes, that was all paper based. And the rostering system that we used was a once the rotors are out, if you get a change or an update, if we don't remember to send that out, it didn't go out. So it was very much a once it was done, it's done. And we couldn't see a lot of the information for our clients in terms of care notes. So we were quite limited on what communication we had because, again, if staff didn't tell us, we didn't know. Just like if we had a change with sickness, if we didn't tell the staff, they didn't know. So there was more opportunity for things getting missed, like, you know, people missing calls if their rotors had changed, or if someone had written something quite serious in the care notes that had happened, and then with a busy morning just forgot to tell us, we wouldn't then have that information to deal with it. So yeah, we were paper based, and I didn't realize how difficult paper based systems are until until we went digital, and then I realized it just was so much better. So oh yeah, we've saved so much time. And we get a lot, like, the staff just feel a lot more informed if there's a change to a care plan. Immediately they'll see that on their app. If there's a change to a client's care calls or they've cancelled, they'll see it on their app. Even little things like birthdays, just like you get a little notification of someone's birthday by their name when it's their birthday, so that they're a lot more informed of what's going on. They have to they don't need to ring us as much for little things, so we've got more time to be focusing on the management and admin, auditing, that sort of side of things. And I think the best thing that we found with it really is families. We've had such a stronger relationship with families because we've got a lot of clients who their families maybe live like 2, 3 hours away, and then because a lot of them have dementia, they'll ring and say nobody's been this morning, and they'll think, oh my god, that's it. The care company, they must be awful. They haven't visited, when actually they just look on the app and they can see that we've been, and their family member just might have got a bit confused that morning and just completely forgotten about it. So yeah, it's definitely helped with that as well. And even just things like, if we've got meetings with healthcare professionals, or people like social workers, best interest meetings, and they want to get all the information, it's so much easier to send it to them through CareLineLive than it is to go to someone's house, photocopy what we've done for that month, and send it over. And sometimes, handwriting isn't legible. So there's that benefit as well. There's other benefits as well, like, we'll have a lot of people say, the carer only stayed 2 minutes or the carer only stayed 5 minutes. And the way that they clock in, you can see how long they've stayed, and exactly where they clocked in and exactly where they clocked out. And so we've been able to address a lot of those things as well. So when it comes to concerns or complaints, we can show exactly what we're doing, and it's evidenced properly rather than just your word over my word. So many benefits that I just the list goes on and on, basically.
So, for the purposes of people watching this, you've been referring to two of the three aspects of the system, really: the Carer Companion mobile app and the Care Circle portal, which is where friends and family, as well as other healthcare professionals, can have access